All right, let's learn about cats. Yeah, Becky has one too. All right, so you may know this, that cats are believed to potentially be the only species that has domesticated itself. And if you know cats well and love them, you would certainly believe that, because they insinuate themselves into our lives or nooks and crannies where they thrive. They don't necessarily offer us any labor in return, but they do make us very happy to be around them. They have been living successfully outdoors at the periphery of human society for over 10,000 years. Does anybody know when cats were really brought inside and considered to be potentially 100% indoor cats?
Cat litter.
Cat litter, when was that developed? The 50s, post-war. So the idea that we have to get all these cats out of the environment into our homes and lock the door is a very, very new one. It's a very North American one, and is not the way cats are viewed in most of the world. So we need to just put our perspective in historical context when we're talking about how to manage cats. How many cats are there? There are millions and millions. There's tens of millions of cats in the United States. And when you're planning your own local programs, it is very important to understand how many cats are in your target area. And your target area may be a single colony, which is pretty easy to deal with. It may be a neighborhood, a park, or it may be a county or larger areas, which becomes almost insurmountable. So it tells us how careful we need to be with the resources that we have so that every penny and every volunteer moment is spent as effectively as possible. So we know there's about 86 million cats in the U.S. that people own, and we have done a really great job teaching them about spay and neuter. The vast majority of pet cats are ultimately spayed and neutered, not always early enough, so there's a lot of accidental litters, but generally people will get their pets neutered after that happens. There's an unknown number of community cats that are out there. Estimates range as low as 10 million up to 90 million, the same number as pet cats. And this would include the feral cats, the friendly community cats, loosely owned neighborhood cats. And only about 2% of these are neutered. So it is very, very clear that the primary source of cat reproduction is this community cat pool. And if we are committed to controlling that reproduction, then we need to address that pool very decisively. So how do you know how many cats are in your community? Well, you go to the census website, which happens to be down right now. When I went to look up the population of Jacksonville, we are in a federal budget shutdown, and didn't know the census site goes down when that happens. But if you take Jacksonville's population, divide it by about 6, it's about 150,000 community cats that Rick has to get neutered. So that's an enormous amount, and all of our communities, even smaller ones, are going to quickly overwhelm us when we think about these kinds of numbers. So Operation Catnip, which is what I'm going to spend the rest of my time talking about, is some practical tools and procedures for running large-scale intermittent mass-style clinics. So these are clinics that you set up in a transient area to do a whole lot of cats in one day. This is a free spay-neuter clinic for community cats in our county only. That is hard for us because we're a suburban county in Gainesville with a lot of resources, and we're surrounded by very rural Florida counties that have nothing. But we also know that there's about 40,000 community cats in our county, and we want to focus on reaching no-kill status in our county before we start diluting our efforts in a bigger way. So we do restrict the cats to our county. All of the cats get spayed and neutered, ear-tipped, vaccinated, treated for parasites. And we run anywhere from 150 to 300 cats in a single day. This requires a lot of volunteers, so usually 5 to 10 volunteer veterinarians from our community or from the vet school, a large number of veterinary students, as well as lay volunteers that come. And it costs us about $40 a cat. So if we just take our entire budget, that's the bank and the phones and our equipment purchases and all the disposable supplies, a little bit of staff, divided by the number of cats we do surgery on, it's about $40 a cat. And I think this is an issue that is really critical to me, is we are constantly underfunded. We could get more cats neutered if we had more money, but this is the limiting factor for us. The community does all of the trapping for these cats. We don't have to go out and trap. There are more people that would be willing to bring their cats in if we could accommodate them. And I think this is a challenge. I see some heads nodding that everybody deals with. You know, nationally, there's only a few organizations giving out grants that all of us are applying for, and only a few of us will get. And so it does come down to local fundraising, and a lot of us, especially veterinarians, are not very good at doing that. And so this is hurting our efforts to save cats. So this is the beautiful surgery facility at the University of Florida. This is where veterinary students learn to do surgery. I'm sure any of you that have your own clinics are very jealous of the space, as you should be, because it's just awesome space for large-scale clinics. And this is what it looks like before we start, and then this is what it looks like when the volunteers are all hard at it. As I'll show, the steps we go through, volunteers have a single task that they do, and the cats actually are migrated through all of the steps in order to get all of their treatments done. So this is a view from the OR area where all of those veterinary students and veterinarians are doing surgery. It is really important that we give our cats the highest quality services that are available. Just because cats don't have an owner or maybe belong to a shelter or they're free roaming does not mean that they have different medical needs. So it is very important that all of the people involved in program management understand what the current standards are and give those to all animals, not just ones with owners to pay for them. So there is a document that's published in the Journal of the American Veterinary Medical Association that establishes standards for spay-neuter clinics. Most of the spay-neuter clinics in the U.S. that I visit meet these, and they're often better standards than what are delivered in private veterinary practices because these are specialist clinics that do one thing over and over very well. But I do visit some facilities that take a lot of shortcuts and unfairly treat these cats as second-class citizens. And then internationally, it's even a bigger deal where Americans go down to the developing world and don't always bring their high standards with them. So what does that mean for our cats? When we talk about high-quality, high-volume spay-neuter minimum standards, these are designed to protect individual patients and staff while attaining high levels of productivity. So we can do a lot of animals and still have very high standards. You don't have to sacrifice one for the other. So every single animal will receive appropriate professional care regardless of their status in life. We'll use safe anesthetic and surgical techniques. We will be clean and aseptic at all times and maintain surgical sterility. All of our patients are going to get pain medication because we know surgery hurts, and we're going to keep detailed medical records that allow us to evaluate our own programs and have continuous quality improvement, as well as meet all of the legal standards that veterinarians have to comply with. So this is a high-volume clinic, and it is organized to get as many cat surgeries done as we can and still stay safe. So we want to look at high cat numbers. We want to handle these cats in a way that minimizes their stress, because any cat that goes to the vet is going to be stressed, and feral cats are going to be even more terrorized by the handling. And we want to keep the cost down. So we don't want to undermine our care by being too cheap, but we're going to be looking at really efficient ways of running the practice, which might be buying in bulk or shopping around for the best deal or trying to get donations when we can. We do run fixed clinics, so this will be volunteers staffing a single procedure. It might be giving antibiotics or shaving a cat before surgery, and then the cats will just work their way through the system, and their medical record is updated at every step. And safety is very, very important, not just for the cats, but also for the people who are going to be at this clinic. So, of course, handling frightened or feral cats is very dangerous. They will bite and flee or scratch trying to get away. And so we have developed systems that we never have a bite, we never have a scratch, we never have a loose cat unless there's a trap that has a defect in it and it opens unexpectedly. So we never handle the cats awake. We require that all of the cats come to us in wire traps, and we have a trap bank of about 400 traps that we loan out every month. And then we inject them through the side of the trap, and as soon as they're asleep, then we can get them out, and they're very safe and not stressed when we handle them. They need to be monitored constantly. Who knows when the time of the highest risk is in anesthesia? What phase of anesthesia are we most likely to have a cat that has trouble breathing or having its heart beating? So absolutely, I'm so glad to hear this. Recovery is when most cats die, and that is when that's an area of the clinic where we tend to put our least experienced volunteers or have no one monitoring them. The cats are put in another area and not watched. And then induction is also a very risky time. An anesthesiologist compared anesthesia once to me as a flight on a jet, and the 2 times that you're scared is takeoffs and landings. So induction and recovery are when you should be scared. That's when planes fall out of the sky, not so much when they're just flying at 30,000 feet, which is the time of surgery, which is when they tend to get the most monitoring, but they're actually the most stable at that time. We have everybody wearing gloves all the time because we don't know what cats might have ringworm or something that people could get saliva on them. Who knows if we've had, we don't know about a cat with rabies yet that came through, but we'd sure hate to have to deal with treating 300 volunteers that might have handled a rabies cat. And our volunteers, if they have any cat handling, have to be vaccinated against rabies. We recommend this for all programs, but it's actually required by our safety people at UF, and the volunteers have to pay for this themselves. So that's usually in the $600 range. So if they want to have a station where they have hands on the animal, they have a pretty big investment. Now in Gainesville, a lot of these are pre-vet students, and they know they're going to have to get it eventually anyway. But really, if you think about it, in Florida, we are a rabies endemic state. Every year there's cats with rabies. So really anybody who works in a veterinary clinic or in an animal shelter should be vaccinated against rabies. For the cats, we want to minimize the stress, so we don't like handling that requires you to move a cat from one container to another or to get it out in some sort of restraint device. Keep them covered at all times. Monitor them at all times. Keep our standards high. And again, only handle them when they're asleep. So the monitoring at every station where the cats arrive, they will, the first thing that happens is the volunteer will assess their breathing and their color and make sure that they're stable. And we have an emergency station where there's a fully stocked crash cart with emergency drugs and equipment. And so all the volunteers know if they have any question at all, they just send the cat right there and a veterinarian will evaluate it. So at each station, the volunteers also have to match up the identification on the cat with its record so that we don't get mix-ups. What we have found is if you get one mix-up of a cat in a clinic, it causes this horrible domino effect, and then you get lots of cats mixed up. And of course, they need to go back to their right colonies. Ask, how are they? How's your heart rate? How's your respiration rate? Your color? Are you doing well? And what do you need from me at this station? Is it just routine treatment, or is there a flag on this cat to do something special, like special antibiotics or a special prep? So it all starts on the first day, at the beginning of the clinic at 8 o'clock, when our caregivers, who are community, just people feeding cats, check out traps from us, and they bring them in covered so the cats are less stressed. Our volunteers that check them in will try to verify that the cat's not been fed, although remember, we have to feed them to trap them, so we know a lot of cats have eaten recently, and so we will, if we know a cat's eaten recently, we'll flag it and do their surgery at the end of the day. They have to bring them in a wire trap, which we loan out for deposit that they get back if they return the trap. Rick and I were laughing once. I was saying, how do you get your traps back? We're always running out of traps, even though we have this foolproof process, supposedly. And he goes, oh, you're supposed to get them back? I thought I was just giving away traps. I think we've all faced that, right? You can never have enough traps. Although right now you may be able to buy traps at a discount for National Feral Cat Day. So we check into that, which is coming up. Last year I bought 100 traps for Feral Cat Day. We try to get some money out of the caregivers. It does cost money, about $40 per cat. The caregivers donate about $5 per cat. So we need to raise the rest of the money. And then we tell them what time to come and pick up their cat. So this just shows a volunteer bringing in cats that have been checked in. And these are our cats in the waiting area. We're just first in and first out, so the people who arrive early are going to be the first ones to pick up their cats. Again, 150 to 300 cats checked in by 10 a.m. If a cat has a URI, of course, we know that they're infectious, so they'll be held aside in an isolation area and have their surgery last, along with the cats that were fed recently. We use TKX anesthesia, which we really like. It's a combination drug that is delivered by injection only. We don't use gas routinely, although we have several gas anesthesia machines in case we need either oxygen or gas to finish the surgery. What we love about it is it's very small volume, about 1/4 ml, very predictable onset, there's little vomiting. What we don't like about it is it's very slow for the cats to recover from it, so our cats are groggier than we would like when they go home. And we have experimented with a lot of different cocktails, and this is the one that works the best in our big clinics. Our big clinics are loud and very stimulating, and I've not been able to use Domitor-based products in my big clinics. I use them when I'm doing small clinics because it's much more reversible. Again, injected through the side of the trap as soon as, and we don't weigh the cats, we just estimate weights, so we have a range that the anesthesia volunteers know that they can use. As soon as they're asleep, they get taken out and they have their eyes lubricated with corn oil. It's a little cost saver that you can use. Instead of buying eye lubricant, you can use corn oil as an eye lubricant, but just make sure you use it fresh each time you get it out and you don't store it in the bottles. And buprenorphine is a pain medication that they're going to get after surgery, and we have the gas machines available if we need them. This is one of our best anesthesia volunteers, and he's very good at monitoring these cats. Nothing gets by him if there's a cat in trouble, and so this cat is now asleep, and he's going to be bringing it out. And then this is an identification system that works super well for us. It's a twin tag system. So when every cat has its unique identification number that starts with the year it was brought in. So our cats this year all start with 13. And so for the lifetime of our program, we can track all of the cats in it. And then they're just sequentially numbered after that. And so when cats are checked in, they get a set of sticky tags, and those will be put on the top of the trap. And then when the cat comes out of the trap, one of the tags will go on the cat, so they will be matched back up with the proper trap at the end. It works really well for us. We do have a veterinary exam for these cats. Right after anesthesia, they go to a table with a couple veterinarians and veterinary students, and every cat gets a quick exam. This is not a thorough physical exam to identify all of the issues with the cat. This is an exam that really is designed to answer 2 questions. Is there a reason you should not have surgery today? You're too skinny, you're too sick, you look too anemic. Or is there something special you need today? You need to get an eye removed or a wound clipped or something like that. That's the purpose of the vet exam. There's scan for microchips. If we find a microchip, we kind of hold that cat and try to call the microchip company and track it down. Of course, you know how that goes. Every chip is still registered with the adoption agency that provided that cat, and they never updated the owner information. And it's Sunday, so none of those agencies are open and going to answer the phone. So if we have chipped cats, we can't get a hold of the owner, we make the assumption this is a stray living in the community, and we go ahead and tip the ear and return it, even if it's already neutered. We have Convinia and Baytril for exceptional antibiotics for animals with more severe cases, and then we also have some standardized discharge orders for special situations like URIs and wounds. This is a picture of a cat. Both of his eyes look like this. That's called a cherry eye or a prolapse of the third eyelid. So this is a cat that we would hold aside and on another day do something special for his eyes. All of our cats get a penicillin injection before surgery. It's a long-acting penicillin injection. And of course, everybody gets ear-tipped. We do also put some cats through an adoption path, and those cats would not be ear-tipped, but in general, we're going to be totally separating out the cats in the TNR program. If caregivers bring us cats and they say they want to adopt it out and they don't want the tip, we don't give them that option. Everybody who comes to us from the outside gets an ear tip. We have never found that having an ear tip prevents a cat from being adopted. In fact, some people kind of like the story about them migrating from their rough life on the street to being indoors. And it needs to be an ear tip that is substantial enough that you can see it across the street at night, right? So you don't want something that, a black cat at night with a flashlight, you can't tell if it's ear tipped, because the whole point is to know whether you have to try to trap that cat and neuter it, or if he is trapped, can you just let him go, or are you going to haul him in to the clinic? So we just put a straight hemostat across and cut it with a scissor, and that hemostat stays on during the clinic. Then we have another table. All they do all day long is express bladders. So all the females get their bladders expressed if they're not pregnant, and then the cryptorchid males too. So if they're cryptorchid, we are going to go find that retained testicle, and the size of the incision for that is going to be the size of the bladder. So we want an empty bladder because surgeons get really annoyed when they have a big long incision to sew up. We make our own Spay boards. These are plastic boards that we've cut and then drilled holes in, and we have tie downs for them. So what this does is it allows us to tie the cat down, shave it, and prep it, and then we can move it through its system without contaminating that site that we've just made sterile. These are really important for the way our clinic works. We do both the midline incisions for our routine spays, or we might do a flank incision. We use that mostly for cats either that have like some dermatitis on the midline, or more frequently that are lactating, just so we can stay away from the midline on those cats. An advantage of the flank is that if there is an incisional complication, it's very unlikely that internal organs are going to come out of the flank, whereas if you have a midline incision that breaks down for some reason, which really shouldn't happen, but it does sometimes, it's life-threatening. And cats probably do die out in the woods because an incision complication happened, and if it's on the midline, things are going to come out. So I really like the flank spays. We have these diagrams that show the volunteers exactly how we want all the different cats prepped. So nice big shave on the belly for these cats, or in the flank approach. And then we clip the males as well. It just gives everybody a really clean surgical field, and it just speeds everything up to clip rather than pluck them. If it's a crypt orchid cat, we have them just routinely clip the whole belly and the scrotal area, so that depending on where the testicle ends up, the surgeon is prepared. And then we're now using chlorhexidine. We've migrated away from the iodine preps because it is more effective and a little less likely to have reactions, and just easy to use. It is more expensive, but we think it's better. So just shows the pattern you're supposed to use when prepping. And then what really makes this all work is a transporter. So between every station is someone whose sole job is to move it from this table to that table. That way your people working at the station are not leaving to move a cat. It also provides someone to watch cats that are waiting. You'll see a picture where we have some cats waiting for the next surgeon, and you want to have somebody monitoring those cats at all time, even though there's nothing being done to them at that moment. That's what the transporters do. So for our Spay, we're going to be focusing on that high-quality system, to be efficient, to be sterile, also to really focus on being minimally traumatic, so small incisions, short surgery times, gentle tissue handling, because those are, if you don't follow those are the things that cause infections in cats. We do require caps and masks for everybody in the OR area, both the vets and the assistants, but we don't wear gowns. So surgeons who are used to wearing gowns have to be very careful that their arms don't get exposed. You can see this surgeon's got sterile gloves on, but their forearms are exposed, so you just have to be cautious not to contaminate the drape with your arms. So for castrations, we actually don't use surgeon's gloves. We use exam gloves, but they're new for every cat. We're very, very careful not to have any blood contamination from one cat to the other, because that's a great way to spread retroviruses. And the main thing is just to be a really good surgeon and getting those knots tight on the cats so that there's no bleeding. And our veterinary students do all of the castrations and about half of the spays. Then after surgery, we vaccinate them. We save this for after surgery just in case they might have a reaction. So we're more likely to notice a reaction if they're recovering from anesthesia than if they're under deep anesthesia. So we can react to it. And we use an FERCP-FELV combination, but we get ours donated. So if we had to buy this, we would not buy this expensive vaccine. They would just get FERCPs. I get a lot of calls about whether it's indicated to give pan-loop combo vaccines to community cats for a couple reasons. One is if they're adults, aren't they already exposed and don't need it? Or it's only one vaccine and people think they won't respond with only one vaccine. Or people think that they can't respond under this stressful environment of surgery. And we've done studies that show none of that is true. You can give a feral cat one vaccine at the time of surgery and they respond beautifully and make really high levels of antibodies. We also know that over half of them are not protected as adults. They've never seen that virus before, and it kills. The reason we're vaccinating really is for panleukopenia. And usually what happens when you have a panleuk outbreak in a feral cat colony is the first thing caregivers think is there's been a poisoning, because all the cats just die suddenly and they're just found dead. So there's always, someone's poisoning my cats. Occasionally, there have been reports of the outbreak actually being centered at the spay-neuter clinic, at the TNR clinic. So some cat went through shedding pan-luke, everybody else got exposed in a clinic that doesn't vaccinate, and then you have multiple colonies reporting suspected poisonings. So I feel strongly that we need to just find the money to buy this vaccine. And of course, rabies vaccines, there's no debate about that. Every cat needs to get rabies vaccines. We have had a lot of discussion about what do you do about that kitten that's not quite 3 months of age, but you know you're not going to get to see this kitten again. So what we recommend is you vaccinate everybody, regardless of the age, and that on your rabies certificate, you have a place that you can check that says, it documents the vaccine, but it says that this kitten was less than 3 months of age. It is not a valid vaccine. It should come back in a couple months for a real vaccine. And that just politically helps you in your community if you're getting pushback about rabies vaccines. It's probably going to protect that cat for years, even if it's underage. And a single vaccine will protect cats for as long as it's licensed for. So, for instance, a vaccine that's licensed for 3 years will protect cats for 3 years, even on the first vaccine. It's just that legally it's not going to be recognized as having a 3-year permit. And so we all deal with a lot of pushback on that issue from the public health folks. Still, we know in our county, Operation Catnip is the single biggest provider of rabies vaccines. We're doing more to prevent rabies in our county than any other veterinary clinic or agency by vaccinating so many cats. Fluids, so the surgeons, if they think a cat needs fluids, either because it was a really long surgery or a very pregnant cat or some blood loss or they were dehydrated, the surgeons will just order fluids and that'll be given post-op. Of course, being very careful to use a new needle on everybody so we don't cross-contaminate everyone. The other thing that I meant to point out earlier is all of our cats have their own little fleece pad. So we buy these huge rolls of fleece, cut them up, we've got about 300 pads, and they're about 2 foot by 2 foot, and so every cat gets a pad at Anesthesia, and it stays on that same pad throughout the clinic, and that does two things. It helps keep them warm, and hypothermia is the enemy of us in these clinics, and it also prevents cross-contamination because each cat is on its own little surface that stays with it. Then post-op, they get the buprenorphine for pain management, and we actually give this on the gums because absorption of buprenorphine is better on the gums than if you give it by injection, which seems counterintuitive, but it's been well documented. And this will last probably 8 to 12 hours. I think a big challenge for us that we've not figured out how to solve is how to give our community cats that are going to be released the next day enough pain management for several days after their surgery. And I just don't think we have a good answer. Some people are using the long-acting, the 3-day buprenorphine, but occasionally those cats will have sedation effects, and so you don't want them having that when they're out on their own. So for parasite control, we're currently giving Advantage Multi. That is a very broad spectrum product. We have in the past used Revolution, which has a similar spectrum. What I love about it mostly is that it is very good against ear mites and also different kinds of fur mites that they might have, like mange. It will kill also internal parasites that are common in cats, like hookworms and roundworms. And then if you give it every month, it'll also prevent heartworms, but we're not going to do that. So the flea control and the ear mite control and the internal parasite control is the real benefit. And I believe that even, and this comes up, is should you invest in this when you're only going to give one dose and the cat's going to go back to its contaminated environment? Of course, we get it for free at the vet school, so I don't have to make that hard call. When we were buying products, we used ivermectin, but that's not going to work on fleas, and it's not as good on ear mites either. So I believe that even just knocking down the parasite burden for a period of time allows the cats to gain some condition and also allow natural immunity against these parasites to develop. So we're not going to cure them of parasites or prevent them from getting parasites again, but we may have certainly some temporary relief and maybe also get the cat off to a better start. I think it's especially important in your juvenile cats because the parasites really can weaken them at a time that is very stressful in their lives. A caution about Advantage Multi is it's got moxidectin in it, and that is slowly absorbed if it's on the skin and rapidly absorbed if it's ingested. And if Advantage Multi is ingested by cats, it is fatal. So it is very, very important that you put it on a place where the cat can't possibly lick. And I would use it cautiously also on cats that are lactating to make sure that the kittens don't nurse on it. So I like to put it kind of right at the base of the skull and just make sure it's dry before it goes back to be around any kittens. And then at the end of all the processes, we give an injection that reverses anesthesia. And unfortunately, this reversal is not that potent. So it does help the cats wake up faster, but they're still going to be very groggy, and especially if they've gotten cold. So we do try to fight hypothermia because that delays their recovery as well. So every cat gets its own pack. Actually, our neuter instruments and our ear crop instruments are all bulk packed. So every cat gets its own instruments that are sterile, and they're put into the wash bucket as soon as they're used. But for those surgeries that are not sterile surgeries, we just take them out of one big bucket of sterilized instruments. For the spays, every cat has its own pack, and we don't reuse anything before it's been cleaned and autoclaved. We actually, because we only do clinics once a month, we bought cheap Pakistani instruments. So they cost us about $30 a pack, which is quite reasonable to have 200 packs or so, which is what we have. And they have paper drapes. I'd really love to get away from the paper drapes and use cloth if we can. They're nicer to use. But we don't have any laundry going on at the time, so we can't. Occasionally when you get Pakistani instruments, there's going to be bad ones, and you just need to remember to throw those away during surgery and not get them back into the packs. And then in recovery, when the cats are out having their procedures done, there's a whole team of volunteers that are cleaning the traps, lining them with newspaper, and stacking them in order so as soon as the cat is done, it can go back into its own trap, matched up by that ID number on the paw. And we have volunteers that are watching them continuously to make sure that they're recovering okay. It can happen that a cat can be in recovery for an hour just doing great and then die. So our volunteers that work in the recovery station understand that, and they're very attentive and bring any cats that they're concerned about to our attention right away. And discharge is a very important step because we are returning these cats still groggy and with instructions to be released the next day if they're doing well. And we do need to make sure that the people who are receiving these cats understand what their responsibilities are. Florida has temperature extremes, so they can't haul them in the back of a pickup truck back home during the summer or leave them out in the winter on a porch to get cold. So they need to be in a climate-controlled area for transportation and recovery. We have discharge instructions that say what's normal and what they should call us for. I carry my cell phone is what they get information on their discharge order. So if they have a concern after hours, they call me, and then we deal with it. We do all of our own emergency coverage, which is annoying sometimes, but you have to have a backup plan for these cats. And if you can't provide that, then you need to make some kind of an arrangement with an emergency clinic or other people to be available 24 hours post-op. And we tell people to leave them in the trap overnight. You won't know how many people who are calling me on the emergency line complaining because they took the cat out and it's on the bed and it's staggering around or it's crying or something, not like the other cats. And so they're not very compliant, which I think is a risk because they can get bitten. And then there's going to be a bite report, and then someone's going to be knocking on your door about your program. So keeping the caregivers organized and in line is a challenge and needs some attention. Of course, the cats are going to be covered everywhere they go. We tell all of our volunteers and our caregivers that the trap should look like it's got a ghost costume on. Like, don't put a little doily on the top of the trap and think that cat feels secure, because when you carry it, even like this is an inadequate amount of coverage, because that cat can see through the side. He can see all the legs that are going by. He needs a good drapey cover to feel secure. He needs to feel like no one can see him. And then, of course, this is the most fun part of this process. It is just amazing how these cats that just had surgery the day before can fly, can just be a blur out of these traps. I really admire their agility. I've had major surgery, and I definitely wasn't capable of running anywhere the next day. Before I introduce our executive director to talk about how we've taken Operation Catnip to the next level to meet the needs of our community, I just wanted to let you know that we have a training course we offer once a year at the University of Florida to teach veterinarians and veterinary students from around the country how to run a clinic like this. It's a week-long, full-time course. About half the time is spent in the classroom, about half the time is spent in the clinic, and we have 30 people that we can take, and they come from all over the country. So if you are a veterinarian or a veterinary student, or if you know of one who could benefit from this training, these are the dates of our next course, and you can go to our website and get information about it. This course is kindly sponsored by PetSmart charity, so it's kept really affordable. All right.